considering the circumstances in which we were working and the kind of patients that we were seeing, it is a miracle that no one died in our clinic. Patients were coming in wheelbarrows, people were being carried in litters and on doors, and were just being deposited there with all of their injuries and illnesses, all pre-existing conditions of all sorts, some of them with underlying serious illness compounded by all of these injuries. And somehow, no one died. Yeah. And we came very close with an 86-year-old woman with a fractured spine who appeared to be having an acute myocardial infarction right in front of our faces. And we had a most fortunate relationship with the Miami University Medical Center, which had a MASH unit on site at the airport in Port-au-Prince. And we had liaison with our command center. We were able to put that patient quickly into a truck and send them to intensive care at the medical center, and that patient survived. We sent about a dozen patients over there, all with very serious injuries. But here an older child, about 4 years old, had been struck on the head during the earthquake at home, appeared to be all right, and then suddenly was losing consciousness at home, and the mother wisely brought the child in. We found it had a hemiparesis on the opposite side, obviously had a subdural hematoma, which is a blood clot that can cause death over time. And this child was taken over to the hospital where there were neurosurgeons and others who could care for the child. So we expect full recovery in a child that would have otherwise died. And it was a big help and encouragement. It was satisfying to a surgeon to be able to bring cases to some satisfactory resolution rather than simply applying dressing. So we were not interested in just counting numbers of procedures done. We wanted to make sure that we had patients who were brought from a position of, it might have either been death or incapacity for life, and be able to actually restore them to the family and to some reasonable ability to support themselves in the future. It's a Salvation Army approach to life, and so we had that, and supported by all kinds of people. One of the things that impressed me about this was the resilience of the people there, and everything from hearing them singing at night to finding the support of people who were willing to come from their own difficult circumstances. We had translators among the Salvationists from Port-au-Prince itself and from surrounding towns who would come in from their difficulty. They were unemployed. They themselves had no source of income, and they would come and work with our doctors and translate for them. And I was touched by the willingness of these people to participate with us in ministering to their own people. But I think all of us were moved as we heard the folk in the tent village that Cindy Lou referred to singing, "I must have Jesus, I cannot bear these burdens alone," nor can we.
Yeah.
Yes.
There's so many donors and people that will be contributing to our help in Haiti right now. Is there anything specific you would want to say directly to our donors to encourage them?
Well, I think that all of us want to do what we can for Haiti. And we are really grateful for the generosity of people who are willing to give of their own resources to share with those who have so little. We're very impressed with the fact that earthquakes like this sometimes are blamed on an aloof God who doesn't care about the needs of people. But we're very impressed as we go to a place like this that God is at work there. And we can see that in 100 ways. We can see that in the way in which people are moved to act as agents of God's love and compassion in the world. And in order to support these people who are experienced and able to go, we need support. And for those who want to do something practical for Haiti, I can't think of an organization that is likely to get more bang for the buck than the Army. And it's an investment in the future. The Salvation Army has been in Haiti since 1950. Institutions are all across the land of Haiti. We have credibility and access, and we're going to be in Haiti for the long term. This is not just a short-term effort to do something, but our intention is to be there until houses are built, till people are employed, until the infrastructure is improved, and until people are back to not just normal, the way it was before the earthquake, but to a better Haiti. That is the hope and goal of the Army.
Right. I was just going to add, one of the things that I've heard since I've been home is that many people don't want to give to Haiti because they feel that the situation is hopeless. And I would differ with that. I think that the people of Haiti are just the people that Jesus talked about. Giving the cup of cold water in his name, the least of the least, some would think of, but they're also the whosoever that Jesus died for. And we shouldn't give up hope on Haiti. I think the potential for redevelopment and reconstruction, not only politically and geographically, but a whole new spirit to the people of Haiti. And it's going to start with people like the Salvation Army, people of God, people of faith, that really have a love for other people.
Well, thank you so much, Dr. Rader, Dr. Drummond, for sharing, for your service. God bless you.
Thank you.
God bless you, Jeff.